call the licensing occupations first meeting of the session to order. Clerk, please call the roll.
Representative All.
Here.
Representative Banta.
Present.
Representative Callaway. Representative Kleins. Representative Dietz.
Here.
Representative Donworth. Representative Pfister.
Here.
Representative Flannery. Representative Hampton.
Here.
Representative Heverin. Here. Representative Huff.
Here.
Representative Jackson. Representative Kulkarni. Representative Meredith. Representative Neighbors.
Here.
Representative Raymer.
Here.
Representative Wilson. Here. Representative Smith. Yes. Representative Gentry.
Here.
Chairman Cook.
Here. Okay, we have a quorum. We're ready to get started. We're going to go a little bit out of order. We're going to start with House Bill 387. As Speaker Pro Tem Meade would go to the table, introduce himself for the record.
Thank you, Mr. Chairman, members of the committee. My name is David Meade. I'm Speaker Pro Tem of the House.
I believe we have a committee sub to adopt. Is there a motion to approve? We have a motion, Vice Chair, seconded by Representative Pfister. All those in favor signify by saying aye. Aye. Then we have a one-word change on a committee amendment. We dropped the word statute on there. So is there a motion to approve the committee amendment to the committee sub? We have a motion by Representative Pfister. Is there a second? Second. All those in favor signify by saying aye. Do we need? All right. Representative Meade, the floor is yours, sir.
Thank you, Mr. Chairman and members of the committee. Several years ago, the Controlled Substance Council tried to include veterinarians for reporting requirements. It turned out to have extreme complications at the time, and from that point, there was statute created that said that veterinarians would specifically be excluded from these reporting requirements in KRS 218A 182. There's just simply too many questions and complications for it. But back in December, the council decided that they were going to initiate a regulation that would include them in reporting. Of course, those of us from rural Kentucky understand the importance of our veterinarians right now and how we have made this a priority in the House, especially with asking Murray State to start a vet school. So we are trying to bring veterinarians into the state. They're not prepared for this type of reporting. There's also so many complications, as I said, a lot of questions. With CASPER reporting, that report would have to be done on the owner of the animal, not the animal itself. So how does a doctor gauge that? How do you determine the medicine that's being used? And how do you differentiate between my 2,000-pound bull and my 50-pound dog? Folks who own 200 head of cattle may have an astronomical amount of these drugs on their CASPER report, or if you own a horse farm, as you do, Mr. Chairman. The bill ensures what statute already says in your committee sub, that there will not be reporting requirements for veterinarians through regulation or any other means. It also removes the emergency medicine physician and the acute care nurse from the Controlled Substance Council, but adds 2 veterinarians to the board, one specializing in large animal livestock and one specializing in equines. The veterinarians have said that they're open to the discussion of reporting, and those discussions will continue. They're absolutely open to that. And if there are discussions that are going to be ongoing, then veterinarians need to be on the council to have those serious discussions.
Thank you, Mr. Chairman. Thank you, Speaker Meade. We spoke briefly on the floor yesterday. I'm for this bill as a farm kid, 100%. My dad would have a lot of trouble with these kind of requirements, so I understand that. I'm just curious as to what other states may be doing in this space. We're not the only, it's not unique to us. So I'm just curious, in your research, doing the bill, what'd you find?
Most states agree that it's just too complicated to have veterinarians to do it. So most states are not. I'm not sure how many are doing it right now, but I know that most are not.
I appreciate the bill. I think it's going to be very complicated for most rural veterinarians to follow these practices. So I'm going to vote in favor. Thank you.
Okay, we have a motion on the bill as amended. Did we have a second? We had a motion and a second. All those in favor, we'll go around the room. Clerk, please call the roll.
Representative All.
Aye.
Representative Banta.
Yes.
Representative Callaway. Representative Kleins,
Please note my attendance, yes.
Representative Dietz,
Yes.
Representative Donworth,
Yes, and please note my attendance as well.
Representative Pfister,
Yes.
Representative Flannery,
Vote yes, and please record my attendance. Thank you.
Representative Gentry,
Yes.
Representative Hampton,
Yes.
Representative Heverin, Representative Huff,
Yes.
Representative Jackson,
Yes, and report my attendance, please.
Representative Kulkarni, Representative Meredith, Representative Neighbors,
Yes.
Representative Raymer,
Yes.
Representative Smith, Representative Wilson, Chairman Cook.
Yes. Bill as amended passes. We need a motion to roll the committee amendment into the committee sub. We have a motion and a second. All those in favor signify by saying aye. We need a motion to adopt the title amendment, the emergency clause. We have a motion and a second. All those in favor signify by saying aye. All opposed, nay. Bill passes. A little complicated for our first one, but we got it through, so.
Thank you, Mr. Chairman,
Thank
members
you.
of the committee.
All right, let's move on to House Bill 45, Representative Deanna Gordon. Good morning. Just have everyone make sure their green lights are on. Introduce yourselves for the record, and you may begin.
Good morning, Chairman and members of the committee. My name is Representative Deanna Fraser Gordon in District 81 of Madison County.
Good morning. My name is Joe Donahue. I'm the Executive Director of the State Board of Accountancy.
Okay, thank you. House Bill 45 modernizes Kentucky's CPA licensure framework with 5 key provisions. It modernizes outdated licensure rules without reducing public protection. It supports workforce mobility and remote practice settings. It enhances Kentucky's competitiveness in attracting and retaining CPAs. It reduces unnecessary regulatory barriers for interstate commerce, and it adds a CPA licensing option intended to address time and cost limitations felt by several candidates under the existing licensing requirement. This measure will better align Kentucky with current professional practice and workforce needs. This model language is supported by the American Institute of Certified Public Accountants as well as the National Association of State Boards of Accountants.
Motion on the bill.
Second.
I'm good.
Representative All,
Aye.
Representative Banta,
Yes.
Representative Callaway, Representative Kleins,
Yes.
Representative Dietz,
Yes.
Representative Donworth,
Yes.
Representative Pfister,
Yes.
Representative Flannery,
Yes.
Representative Gentry,
Yes.
Representative Hampton,
Yes.
Representative Heverin, Representative Huff,
Yes.
Representative Jackson,
Yes.
Representative Kulkarni, Representative Meredith, Representative Neighbors,
Yes.
Representative Raymer,
Yes.
Representative Smith, Representative Wilson, Chairman Cook.
Yes. House Bill 45 passes. Look forward to hearing it on the House floor. Congratulations. Thank you very much.
Thank you, members.
Okay, Representative Neighbors, House Bill 48. May make sure your green lights are on. Introduce yourselves for the record, and you may begin.
Amy Neighbors, I represent the 21st House District.
Stephen Curley, Executive Director for the Kentucky Board of Physical Therapy.
Dr. Avery Schroyer, APTA Kentucky President-elect.
Floor is yours.
All righty. Thank you, Chairman and members of the committee. Today we are presenting House Bill 48. This is the exact same bill that I filed last session. It passed unanimously out of this committee and the House floor. It also passed unanimously out of the Senate L&O committee, but unfortunately, time ran out to get it across the finish line.
Motion on the bill.
We do have a motion and a second, but I'm going to allow you to go through to briefly explain what all we did and what you had the steps you took to make sure that we got everybody to the right page on this.
For anyone who may not recall, this legislation will update the statutes governing the Commonwealth of Kentucky's Board of Physical Therapy. These statutes have remained largely unchanged for nearly 4 decades, while the delivery of health care has continued to evolve. The Kentucky Board of Physical Therapy has been working on updates for the Practice Act for more than 15 years in collaboration with the American Physical Therapy Association of Kentucky. The overarching goal of this legislation is to modernize and streamline a statute that was originally written in 1958. These updates improve clarity, readability, and understanding for both the public and licensed professionals. By supporting House Bill 48, we reaffirm our responsibility to ensure that Kentucky's healthcare regulations are clear, current, and continue to serve the patients who rely on them. At this time, I'll turn it over to Stephen Curley with the board, who will walk the committee through several highlights of the proposed changes.
Okay, so as Representative Neighbors said, most of it is streamlining language to ensure that PTs, PTAs, and the patients understand it. There are some changes that add physical therapist assistant to the definition. We license both PTs and physical therapist assistants. Right now, they are not defined. It switches them from certification to licensure, which has been an insurance issue. They don't want to reimburse for somebody that's not licensed, even though it's a distinction without a difference in the statute. So it's just updating that language to say licensed instead of certified. It's adopting a process in which licensees can ask for expungement on minor violations, things that are unrelated to the practice of physical therapy or patient harm, things like continuing education violations. They would be able to ask for an expungement on those after a certain time period goes by. It gives the board statutory authority to purchase professional liability insurance, which is something that's more necessary after the Supreme Court made a decision in the North Carolina Dentistry Board case several years ago. It rephrases the all reports of violation requirement for boards to, or the physical therapy board, to investigate all potential violations, and it just gives the board some more discretion as far as investigating cases that involve patient harm versus cases that may just be physical therapist is rude to the patient, which isn't something that the regulatory board should be involved in. It amends the authority under disciplinary actions to clarify sexual misconduct. Right now we have lewd and immoral conduct, which is a legally indefensible term at this point, so it just defines what sexual misconduct is in our statute. Per this committee last year, we flipped our fine ceilings and our application ceilings that are currently in the statutes over to regulations, like a lot of the boards have done, so that we don't have to come before the General Assembly if we have to raise our fine ceilings or our application ceilings. We have no need to raise any fees at this point. We are financially fine, so there's no plan in the next 10 years to raise anything at this point, but it would just go into regulation. Change temporary permit to provisional license, which is just, again, a distinction without a difference. It just allows insurance companies and other healthcare companies to better understand and not push back on temporary permit holders. And then internationally trained physical therapists and physical therapist assistants, or foreign educated. Right now it's a requirement for all those individuals that are educated outside the U.S. to undergo a supervised practice before they can start working in the Commonwealth of Kentucky, which, if you're brand new to the healthcare system, an exam candidate, absolutely. U.S. healthcare system is so different than other healthcare systems. It's necessary for them to undergo that supervised practice. But if you've been practicing in Indiana for 10 plus years, it's less necessary. And right now we are required to make sure, even if you've been working for 10 years, we have a lot of entities that go into rural communities, and they have to do supervised practice, which is hard to find somebody in that rural community to do supervised practice with. So it's been a burden that we want to eliminate. Still want patient safety, still want well-educated people. It's just that would allow us to get people into work a little bit faster and still safely.
Okay, thank you. I wanted everyone to hear that, Representative Neighbors, because I think everybody knows we've been concentrating on these boards and seeing what's going on. So I wanted to, these practice acts are not easy things to open up and address, but it's very important that we do so and modernize these. So appreciate all the hard work that you three and everybody else has put into this. We do have a motion and a second on the table, and I don't see any questions or comments. So clerk, please call the roll.
Representative All.
Aye.
Representative Banto.
Yes.
Representative Callaway. Representative Kleins.
Yes.
Representative Deeds.
Yes.
Representative Donworth.
Yes.
Representative Pfister.
Yes.
Representative Flannery.
Yes.
Representative Gentry.
Yes.
Representative Hampton.
Yes.
Representative Heverin. Representative Huff.
Yes.
Representative Jackson.
Yes.
Representative Kulkarni. Representative Meredith. Representative Neighbors.
Yes.
Representative Raymer.
Yes.
Representative Smith. Representative Wilson. Chairman Cook.
Yes. House Bill 48 passes. Look forward to hearing it on the House floor. Congratulations. Not sure who turned on the sun there, but that is very blinding. All right. Thank you. Okay, let's go to House Bill 212. Talk about rabies. Welcome. Make sure your green light is on. Introduce yourselves for the record. You may explain.
Yes. Susan Witten, State Rep for District 31 in Jefferson County.
Is this your first L&O bill?
It is my first L&O bill.
Well, welcome.
Thank
Good
you.
luck.
It's great to be here.
And my name is Lynn Cassone. I am a veterinarian and pathologist, and I am vice president of the Kentucky Veterinary Medical Association.
Thank you. Thank you, Chairman Cook, Vice Chair Smith, and committee members. Today I'm speaking on House Bill 212, which will authorize Kentucky licensed veterinarian technicians, or LVTs, to administer rabies vaccinations to dogs, cats, and ferrets under the direct supervision of a veterinarian who is on the premises. This legislation will provide much-needed relief to veterinarians, particularly in overcrowded animal shelters and humane societies across the Commonwealth. With shelter intake at overwhelming levels, veterinarians are struggling to keep up with the demands of spay-neuter surgeries and medical care. Allowing LVTs to administer rabies vaccinations upon an animal's admission following standard shelter protocols will significantly ease the burden on veterinarians while ensuring health and animal safety. LVTs will sign vaccination records for accountability. Additionally, this authorization will enhance the efficiency of mass rabies vaccination clinics, which are held statewide in partnership with the public health departments during the spring and summer months. LVTs will be able to work alongside veterinarians to administer vaccines and complete necessary documentation, helping to improve access and coverage. As demonstrated by recent data, rabies is on the rise in Kentucky. In 2025, 3 domestic animals tested positive for rabies in Kentucky, and an average of 14 people are exposed from each animal. Finally, this initiative aligns with ongoing efforts to modernize the Kentucky Veterinary Practice Act in collaboration with KBVE, KVMA, and KVTA. Expanding the roles and defining the scope of LVTs while granting them title protection will ensure they are better utilized in both clinics and field work, strengthening the veterinary profession and improving animal care statewide. So at this time, I'd be happy to take any questions or if my guest would like to speak any further on this bill.
Do we have any
Motion
questions?
on the bill.
We have a motion by Representative Pfister. Is there a second? Second by Representative Heverin. Would you like to comment, or would you like us to go ahead and vote?
I would like to comment
Sure.
just to emphasize the importance of rabies vaccination and the level of compliance is absolutely essential to protecting public health. When we protect our animals, we also protect our families and the people who come into contact with those animals. So there is a sense of urgency about ensuring that rabies vaccination is is attainable in all our domestic species. And by allowing veterinary technicians to be able to administer these vaccines, we maintain the professionalism and maintenance of records so we know which animals are vaccinated and that they've been vaccinated properly. And that's essential in the case of an exposure in which we need to be able to trace back and ensure that those animals are protected.
Very good. Clerk, please call the roll.
Representative All.
Aye.
Representative Banta.
Yes.
Representative Callaway. Representative Kleins.
Yes.
Representative Deeds.
Yes.
Representative Donworth.
Yes.
Representative Pfister.
Yes.
Representative Flannery.
Yes.
Representative Gentry.
Yes.
Representative Hampton.
Yes.
Representative Heverin. Representative Huff.
Yes.
Representative Jackson.
Yes.
Representative Kulkarni. Representative Meredith. Representative Neighbors.
Yes.
Representative Raymer.
Yes.
Representative Smith.
Yes.
Representative Wilson. Chairman Cook.
Yes. House Bill 212 passes. Look forward to hearing it on the House floor. Thank you.
Thank you, Chair. Thank you, committee.
Vice Chair, I'm going to turn the floor over to you. I'm going to go down and present House Bill 49. My land surveyors and engineers, I know they're here if they want to come forward.
See, that said Emily Callaway. I wasn't ready for him to do.
Representative Matt Cook, representing the 72nd District.
Kyle Elliott, Executive Director of the Board of Licensure for Engineers and Surveyors.
Jake Miller, General Counsel for the Board of Licensure.
You may proceed.
Thank you, Mr. Chair. Land surveyors been before us several times the last couple of years. We continue to work on them. I want to thank them for bringing this forward. They're actually creating a scholarship, and I'll let them explain what we're going to do with that.
All right. I'd like to start by thanking Representative Callaway, or let you all let her know that I'm thanking her for working with us on this, and Chairman Cook for pointing Ms. Callaway in our direction to reach out to us. So what we're proposing to do is to take $5 from every license renewal that we receive annually, and all of our fines and penalties that we get for disciplinary actions, and apply those to scholarships for engineering and surveying. We've had a decrease over the last decade in surveying and engineering applicants coming in. In state, we've had a increase in out-of-state licensees coming in. And so we're hoping to use this to entice or to keep people on the path towards becoming licensed that reside in Kentucky, and go to school in Kentucky, and work in Kentucky to meet the requirements of the paying back the scholarship.
Motion on the bill. We have a motion on the bill. Do we have a second? And, oh, I'm sorry. We got a second on the bill. We have a question by Representative Gentry.
Thank you, Mr. Chair. You had talked about having requirements to go to school here, live here, work here. Can you explain to the audience of how long they have to work here after post-graduation on the scholarship recipients?
Yes, so Jake, do you have that number? Is it 6 years?
6 years. 6 years.
It's 6 years. We give them 6 years to become licensed after they graduate, after they've quit accepting the scholarships. Usually that's a 4-year period, but we wanted to give them a little leeway for people that may not pass the exam the first time or have life things that come up, you know, a marriage or birth or something like that. And then we require them to work in the state for 6 years. And if they do that, then the paying back the scholarship goes away. There's no requirement to pay us back. There are a lot of national engineering firms that will take engineers from out of the state and pay back scholarships for them as part of an employment contract. So that's also a possibility. But we're trying to encourage them to work in Kentucky.
Thank you for that. I think this is a great bill. Thanks.
All right, thank you. Seeing no more, wait. Okay, I'm sorry. Representative All.
Yeah, I'm for it. I just got a quick question on the $5. Are we raising the fee $5 and there's new monies that's going to go to this, or are you using existing monies, and if you're using that existing monies that we're already receiving, what is that coming out of?
Yeah. So it's existing money. We're not raising the renewal rates. Through online applications, online renewal or email renewal notices, and online renewals of licensees, we've cut down on our expenses. So this cost will not affect us, at least for 30 years by projection. So.
Okay, is that all the questions? All right, we have a motion and a second on the bill. Go ahead and take a roll call.
Representative All.
Aye.
Representative Banta.
Yes.
Representative Callaway. Representative Kleins.
Yes.
Representative Deeds.
Yes.
Representative Donworth.
Yes.
Representative Pfister.
Yes.
Representative Flannery. Yes. Representative Gentry.
Yes.
Representative Hampton.
Yes.
Representative Hevron. Representative Huff.
Yes.
Representative Jackson.
Yes.
Representative Kulkarni. Representative Meredith. Representative Neighbors.
Yes.
Representative Raymer.
Yes.
Representative Smith.
Yes.
Representative Wilson. Chairman Cook.
Explain my vote.
Proceed.
I'm a yes, but this is the kind of positive stuff that I want to see to continue come out of the boards and everybody's boards as you're working towards these and updating your practice acts. This is what we're trying to achieve and move Kentucky forward with. So enthusiastically vote yes.
Okay, House Bill 49 is voted favorably and so shall on the floor. Thank you, Mr. Chairman.
You can shut us down, Mr. Chair.
Do we have a motion to adjourn? We are